Hello everybody. Thank you for being part of what I hope will be an innovative, caring and open opportunity to talk through what this last year has meant. Welcome to my garden. Let me introduce you to Stan and Ollie and Olive just behind me. Olive is a tree we planted some years ago when she was a tiny sapling. She produced her first olives last autumn, something we thought would never happen. Last autumn, that seems like a long time ago. We had the first lockdown earlier in the year, and then the summer outdoor break. Life became more normal for a while. We were able to be together, go for a meal, for a drink, go to work, go shopping, to see friends and relatives, and to football matches and events. Lockdown 2 put a stop to that. For our children and young people who've missed so much of their education, it must have been dreadful not to be able to play with friends and to see people that you'd been at school with. For families too, without access to outdoor space, that must have been really difficult. I guess for all of us, COVID has made life very hard. Lockdowns, being stuck at home teaching our children, worrying about how to pay the rent, bills piling up, putting food on the table, has stressed many, many people. And that's not to mention our NHS and care staff, who must have been through a really awful time, not knowing what the next shift, what the next day, what the next hour might bring. Coping with that hasn't been easy. Add to it concern for those in our families who may be alone and isolated, our friends and neighbours who might be at risk, and of course, the risk of losing loved ones too. I know how things can change and how bad they can be because of some things that happened in my own family. This is really difficult, so please bear with me. My roots are in Liverpool and I have family there. In January this year, my sister, Jane, had a fall at home and was taken into hospital. Whilst in hospital, she contracted COVID. The seriousness of her situation, her rapid decline, came home when I received a call from the hospital at 4 o'clock one morning. Jane had deteriorated. We were advised by her doctor to go to Liverpool immediately to be with her. She died a few days later. We were able to be at her bedside, but it was a devastating experience. My little sister had gone. It was hard to find words to express how I felt. If my brother Michael and his wife Joyce hadn't been there, life would have been extremely difficult for me. I don't know what I'd have done. But we worked together to sort out her estate, her home and possessions, and her funeral. It gave us the opportunity and reason to talk about her, to talk about what had happened and how we felt. But we also remembered the good times, and they made us smile. It helped. Then, some 10 days before her funeral, my other brother, John, went into septic shock from a burst duodenal ulcer. We didn't know whether he would survive the surgery. It was touch and go. Thankfully, he did survive, and after weeks and weeks in hospital and then in care, he was able to go home. As his next of kin, I again had things to do for him, and it helped having Michael and Joyce there to help. We were able to get together, talk things through, and sort things out. Talking to one another, saying how we feel, what concerns us, or what we're afraid of, is a huge benefit. It taught me it's okay not to be okay. And that realization, for me, began the process of recovery. Recovery, that's a word. We often hear about our economy, businesses, towns, city centres, and their recovery. But this isn't just an economic issue. Recovery from the pandemic is for all of us. We need to understand how we feel and why, and what the impact has been. We need to understand the fears and uncertainties we have been living with during the pandemic, and to understand it really is okay to tell people how you feel and ask for help if you need it. That is all part of recovery too. And that's why we're launching Heads Up Cheltenham. Mental health and well-being are important. The Heads Up campaign will guide people, enable all of us to understand better and to know what help is available. How? By recognising that we can't do things alone, that if we need advice or assistance, we shouldn't be afraid to ask for it. That might be something as easy as signposting a person to financial support, or making sure our children's welfare is being looked after, or that our elderly family members or friends aren't forgotten. It might be having a chat to someone, just talking things through the way I did. I was sitting here quietly in the garden recently and I realised there have been lots of things I haven't done over the last year, things that I would normally have done as a matter of course. And I have to say that while Zoom, WhatsApp and FaceTime are fine, they're not like being with people, nor do they take the place of ordinary, everyday things we have taken for granted. So, now is the time to begin. Whether it's a walk in one of our parks, getting on a bus, going to see friends, popping to the local shop, or just going for a walk around the streets near our home. As you will learn from the launch events today, Heads Up Cheltenham is here to help you do so. We can point you to people who will advise, assist and who will listen. Even, as I said, just going for a walk with a friend, helping others or trying something new like baking, which is what I've been doing, or drawing, or going to a cafe to meet people and chat, can really make a difference. So get in touch. We're not here to judge, but to listen and to help where we can. Together, we can make a difference. Thank you for your attention.
So I am delighted that we are relaunching the Heads Up campaign here in Cheltenham. When we first launched the Heads Up campaign back in 2015, it was primarily with a view to achieving two things. Firstly, it was about promoting straightforward, everyday changes that we could all make to improve our own mental health and the mental health of people around us. And secondly, it was about promoting the concept of parity of esteem. That is to say, to ensure that mental health was given the priority and viewed with a similar importance to physical health as part of holistic health and well-being. As we come out of the terrible coronavirus pandemic, it's important, in fact it's essential, that policymakers at all levels acknowledge and seek to address the mental health impact that has affected so many people, particularly children, vulnerable people and isolated people. I'm very excited about the relaunched Heads Up campaign. I'm delighted to give it my full endorsement and support.
Hi, my name's Alex Burridge and I'm the clinical lead of the Let's Talk service, which is a talking therapy service offered by the NHS. I think probably similar to an awful lot of other people out there really, and is feeling quite disconnected from the people that you're used to having contact with. So not seeing my parents as much as I'm used to, not being able to hang out with my friends and engage in all the activities that generally keep you ticking along. Well, I think what you had to do, and I think that's what a lot of people have done, is we've had to think about how we can have those connections in a different way. So I think we've all now probably discovered Zoom and many other things out there to be able to connect with our friends and family using video technology. And picking up the phone more and speaking to people rather than thinking that I'm missing them and I don't know what's going on and I'm, experiencing the loss of not seeing them so much, making sure that I reach out and I get connected in other ways. Well, like I was saying, we run a psychological therapy service that's offered by the NHS. And one of the things that we do is we help people when they are experiencing anxiety or worry or low mood. And we can offer a range of psychological therapies that can help people develop skills to be able to manage some of those feelings. And one of the challenges, the additional challenges that I've had this year, is about how we continue to offer that kind of help and support to people in a different way, because we're used to meeting people face to face and offering that therapy in venues close to them. So we've had to adapt to being able to deliver a lot of that online by using video technology or by using internet platforms to offer people help and support through using email-based interventions. So what people can do if they are feeling that their mood is low or they're feeling more anxious than normal is they can get in touch with our service by phoning us up on our free phone number.
Hello, I'm Marla Euby, and I'm Gloucestershire Clinical Commissioning Group's lead GP for mental health, and I'm a practising GP in Cheltenham. The COVID-19 pandemic has affected us all in different ways, and we know that in these ever-changing times it is really important to look after our mental health and well-being. There are lots of ways to access support. GPs like me are available to talk through any concerns you have about your mental health and provide you with medical support. Additionally, there is the Be Well Gloucestershire website, which is a great online directory of mental health and well-being services. You can use the A to Z to find exactly what you need to help you. There is also Heads Up Cheltenham. Heads Up is a grassroots campaign promoting good mental health and well-being across the town. It is a reminder of how there are many services and activities available for us all to access, including hobbies, volunteering and exercise opportunities that can help to promote well-being. Heads Up will also be listening to what the town's residents say about their mental health and will be organising events that could support both individuals and organisations, such as mental health first aid training. Please do look out for further information on social media and local websites about Heads Up.
Hi, my name's Marianne, and I faced a lot of challenges towards my mental health and well-being in the last 12 months. It's been a combination of factors for me. The COVID-19 pandemic, of course, has played a large part of it. Now, this is because I was very much someone who didn't live in the moment, and I've had to come to terms with how to do that and learn that it's what I should be doing, and I should be focusing my energy on each present day and each situation that is there, not, you know, hiding away from it and looking ahead or further on in the week or further on in the year to you know, steer away from it. I've also had many changes in my personal life, which have been incredibly hard, and I've had to, again, process those, overcome those. For me, breaking it down bit by bit has been really beneficial. So there were times where all I could think about was everything that was in front of me, but I had to break it down bit by bit. So for me, that was selling and moving out of a property, then changing my job, and then relocating. So 3 things there, 3 massive steps which fulfill the 12-month period, which has been really challenging. And I've had to find ways to cope, mechanisms that work for me. So those, for me, have been physical exercise, so running. I've started running, and I'm actually doing a half marathon later this year with my brother, which will be super fun, and I am raising money for Mind, which is so important, and they're such an amazing charity, and I'm really happy to be contributing to them. I've also really loved doing random acts of kindness. I get just such a buzz out of it, and I love, brightening people's day because it brightens mine just as much. And also for me, learning new recipes, doing more baking, having more time to appreciate the outdoors and what's around me has been greatly beneficial to my mental health and well-being. And the most important thing is that these coping mechanisms will continue for me. They won't stop, because your mental health is for life, and continue to do what's right for you and take each day as it comes and just embrace your emotions.
It's really well known that being outside can have a positive impact on your health and well-being, whether it's your mental well-being but also your physical, and that became really more acute in 2020 with the outbreak of COVID-19. But what we're starting to understand is that being outside is not just the element that can support improved mental health and well-being, but that actually it's the connection to nature that can help you to do that. University of Derby have done some research into this, and they can see that it's that connection to nature that can really improve how you feel about your life, how worthwhile you feel your life is. And that connection to nature can be even more important than your socio-economic class. So, for example, how much money you earn. That connection to nature can make you happier than how much money you earn. So how do you get connected to nature? It's not just about spending time outside. It's about looking and paying attention at how the natural world is impacting on our lives. So next time you are out, having a walk, just going between meetings, even if you're sitting in your office and you're looking out of the window, see if you can find anything that helps you connect with nature. Can you see a bird? Can you watch its behaviour? Can you see a dandelion poking up through the pavement, for example? Those little elements of nature can help you stay connected to nature and can have a positive impact on your health and well-being. During last year, when lots of people were furloughed, me as well, it was really important to kind of look at those elements. I watched a pair of dunnocks nesting in my garden, and that really helped me understand that the world was still turning. We might all be locked up, but actually the natural world still has its rhythms and still continues to thrive, even though we're in this massive pandemic. Gloucestershire Wildlife Trust is all about connecting people to the natural world, and if you want more information about how you can do that, you can check out our website. You can visit our nature reserves, they're free of charge, and you can enjoy being in the natural world.
Well, hello everyone. Thank you to all of you for your contributions to this launch of Heads Up Cheltenham 2021. We've heard today from a variety of speakers, both about personal and professional experiences in relation to good mental health and well-being, and heard about some of the resources that are also available. As part of the campaign, we asked the people of Cheltenham to take part in the Cheltenham Unmuted Health and Wellbeing Survey over the last fortnight. We were really pleased that so many took the time to complete the survey and wanted to share some of the results as part of this launch. Heads Up Cheltenham felt it would be a really good idea to have a consultation with all of those who live in the town at the beginning of the campaign, to assess the general feeling amongst the population, both before and since the beginning of the pandemic. It was a short survey to encourage participation and has produced some interesting results, which we hope will inform Heads Up Cheltenham as to some of the areas and activities that could be considered during the year to help the people who live in Cheltenham. A short summary presentation of the results is as follows. The town was initially asked how it was feeling both before the pandemic and at this moment. You can see from the first slide that there has been a decrease in the happiness that people feel and a rise both in neutral responses and sadness. The second slide shows responses to the question, what has made you sad this last week? The graph illustrates the variety of responses, with a significant majority regarding worrying about the future or feeling stressed or worried. Below the graph, we have summarised the themes indicated by the other response. The next slide illustrates the question, what has made you happy in the last week? And again, you can see the variety of responses, with friends, family and colleagues standing out as making people feel most happy. Once again, other responses are summarised below. And finally, the last slide. It shows responses to the question, what one thing do you think would help with your mental health and well-being? We were amazed at having received over 100 different replies to this question. So we have once again summarised the themes of the responses into categories listed in descending order. Heads Up Cheltenham continues throughout this coming year, so please keep an eye on our website and our social media for information regarding resources, activities and ideas for both the community and for organisations. And let's try to help everyone access the support and information they might need to encourage good mental health and well-being across the town for our residents of all ages and all communities. Thank you for joining us. Please take care and look after yourselves.